You're welcome. Today we are going to talk about how to diagnose pregnancy using the signs and symptoms that a mother may experience and present with. Then in the next video we're going to discuss about diagnosing of pregnancy but using the laboratory methods. So let's dive in. In the first trimester, you're going to have amenorrhea, which is absence of menses in a mother who previously had regular periods. They have morning sickness, which mostly occurs in the prime gravida. Then also you have frequency of maturation increasing around the 12th to 8th to 12th week, and this is due to the compression of the bladder by the placenta, by the uterus. Then you're going to have breast changes. The breast starts to increase in size. And then you also have fatigue that might be experienced during the early pregnancy. And then you also have these subjective signs that may depend from one person to another. One, the breast changes. Includes enlargement and vascular engorgement. You have pigmentation of the nipple and areola as they become more darker than the usual color tone that they had. And then you have colostrum that may be expressed at around the 12th week. You have on abdominal examination, the uterus is referred as a suprapubic bulge at around the 12th week, and then uterus undergoes certain changes which include progressive enlargement and then change in shape from the originally piriform shape in mothers who are not pregnant to a globular form by 12 weeks in those mothers that are pregnant. And then we have Heger's sign, which can be demonstrated at around the 6th to the 12th week, to 10th week. And then you also have pelvic changes that occur during pregnancy. One of them is Chadwick's sign, which is the bluish discoloration of the vestibule and anterior vaginal wall due to vascular congestion. You have Seda's sign, which involves increase in pulsation, which is felt via the lateral fornix at the 8th week. Then you have vaginal wall softening, and then there is increased discharge in a copious mucoid liquid discharge. This discharge is non-irritating. That's what you should note. And then you have Godel's sign, which is the softening of the cervix. Initially, before pregnancy, the cervix is a bit harder compared to when a mother is pregnant. And then in the second trimester, nausea, vomiting, and the frequency of maturation decrease whether amenorrhea persists. And then you have quickening, which occurs at around 18th to 12th week in prime gravidas, and then 2 weeks earlier in multigravida mothers. And then you have progressive enlargement of the uterus also occurs. And then you also have chloasma, which is the pigmentation which occurs over the forehead and the cheek from around the 24th week. Breast changes also. And then you have colostrum, which is the initial milk that is secreted, which is thick and yellowish. And then you have variable striae, which are called sometimes stretch marks that occur, and they increase as the pregnancy progresses. In the abdomen, on examination, in your inspection, you're going to see striae gravidarum, which is a black line. And then you have stri, which increases as gestation increases also. Then you have on palpation, you should be able to determine the fundal height, and this becomes accurate from 20 weeks of amenorrhea onwards. Then you have the uterus becoming ovoid in shape, soft and elastic, and then you should also be able to palpate the fetal parts in the second trimester. And then you have on auscultation, fetal tone, fetal heart rate can be determined by using a fetoscope from around 18th week onwards, but before that you can even detect using a Doppler. And then in the third trimester, there is amenorrhea, which persists, progressive enlargement of the uterus, and this causes dyspnea, difficulty in breathing. And then you have lightening that occurs around 36th to 38th week. This is accompanied by a feeling of relief from the mother, as there is a slight descent of the fetus as trying to engage. Then you have cutaneous changes, including linea nigra, and then stri, gravidellum, which become more prominent. And then you have uterine changes. The uterine shape now becomes spherical in the third trimester. And then you also have the fundal height, which increases and going to depend on the weeks of amenorrhea. Then Brixton Hicks contraction become more prominent in the second trimester. They are there, but they are less compared to the ones in the third trimester. Then fetal parts now are easily palpable. The lie, position, and presentation can easily be determined. Then the fetal tone, i.e. the fetal heart rate, are easier to listen in the third trimester using a fetoscope. These are our differential for pregnancy. You have uterine fibroids, ovarian tumors, and then you have encysted tubercular peritonitis, and then you have distended bladder also. Yes. Otherwise, thank you for listening. I hope you learned something. We are going to discuss about the laboratory diagnosis of pregnancy. Check out my next video. Otherwise, enjoy your day.